everybody. It's lovely to be here and talk about what has been an extremely busy but very productive year in the world of the HCA. I'm going to talk to you about kind of what we've been doing in the last 12 months. Obviously, a lot of you will have had contact with our specialist advisory service, and in the last 12 months they've had contact with over 4,000 individuals and supported over 1,000 families, which I'm sure you'll agree is a fantastic achievement. But more than that, it's what difference that they've made to those families. So just as a quote from one of those families, the advisor is an incredible part of the Huntington's disease team. I feel blessed to have her support, and I'm very thankful for the time she gave me and feel a great rapport has been built. She's been thoroughly trustworthy and caring in her manner, a brilliant asset to the Huntington's Disease Association. What a lovely testament about our work. One of the areas of our work that we're really proud of is our youth engagement service, and our youth engagement coordinator James has been working hard supporting 317 children and young people. And again, that's all very well, but what difference has that made? So I truly don't know where I'd be without the support of the youth coordinator has given me this last year or so. He's educated me on Huntington's disease and been there to listen when no one in my family was, and just generally been really empowering for me and to make choices for myself. He somehow manages to turn really hard conversations into positive somewhere, and is the friendliest person I know. Again, what a lovely testament of the work that James has been doing, and I know that he's going to tell you a bit more about some of the exciting moving forward in this project. So there we've kind of come through the other side of the pandemic, or hopefully we have. One of the things that we've learned from that is obviously in-person support is extremely important, but we've also managed to maintain some of the online support that we moved to during the pandemic. And in the last 12 months, we've had 26 webinars attended by over 600 people. We've launched our YouTube channel, and we've continued with a virtual carers group, having 57 meetings and attended by over 300 people. And I think that's an amazing achievement, because for a lot of carers, it's actually really difficult, as you very well know, to get out and attend to meetings. So to be able to do that from their own home is a brilliant resource. Our social media grows from strength to strength, and they've shared knowledge and resources, resulting in the engagement of over 200,000 people, which is mind-blowing when you think about it. And our website is just gone from strength to strength, and that's continually being evolved and developed. One of the key things as an organisation is that we remain relatively small players on a big stage. So working with other organisations is really important. And we've been working with Surrey Heartlands, Kent, Surrey Sussex Academic Health Science Network in collaboration with Roche Products to produce a service model and care pathway for people with Huntington's disease. And one of the really good outcomes of that is actually there is now a care coordinator in that area specifically for Huntington's disease. And that's something that we're looking to replicate across the country. We work very closely with the Neurological Alliance. I'm a trustee on their board of trustees, and we do lots of project collaboration with them. And they're very good and very involved in kind of lobbying, and that's something that we've been working very closely with them. We've been working with the Rare Disease Industry Group, looking at the drug approval process. This is work that NICE do when any new drug comes to market, in terms of whether or not they will approve that. And we've been working with this group to try and simplify that process and actually make it more applicable where it's rare diseases like ours. We're working with the National Neuroscience Advisory Group, and one of the key pieces of work there has been looking at making sure that in the changing health system, changing from clinical commissioning groups to integrated care systems, that actually neurology and rare diseases are not lost within that. And our care home accreditation scheme this year has grown from strength to strength. We've accredited a new care home this year, and we've had lots of interest and some portfolios that we're taking through that process. So I'll be excited to report back on that next year. So obviously better knowledge and understanding is really important, and training and education is one way of doing that. We had our first ever virtual certificated course, and had 84 professionals attending that across 2 events. But alongside that, we run 103 training sessions attended by 891 professionals, alongside information sessions. And we've created a resource section for professionals specifically on our website. And what does that mean? Well, hopefully what that means is that ultimately it will mean better care and support for people with Huntington's disease. People will be better equipped to manage them. And this is just one quote. We have all gained lots of knowledge about Huntington's disease and the different aspects of it. We have lots of residents with Huntington's disease, and this has helped more people gain an understanding. Our branches and support groups remain a key to us being able to support people, and that peer support that people who are living with the illness can give to other people living with the illness. We've got 39 branches and support groups throughout England and Wales, and that's provided vital support to the Huntington's community. And they've really risen to the challenge of continuing to support each other, even through the thick of the pandemic, when that was really quite difficult. HD Voice is a project where we have people with lived experience of Huntington's disease who can give their view on lots of different projects, and this just gives you a little snapshot of some of the examples of where HD Voice have been able to offer their knowledge and expertise of living with Huntington's disease, or caring for somebody with Huntington's disease, or being at risk to Huntington's disease, and actually the things that really matter to them and that will help them. You'll be hearing from our patron George a bit later, I'm pleased to say, but we continue to work closely with the BBC as the Casualty Huntington storyline continues, and that's been going on for several years now. The BBC are very keen that they portray Huntington's disease very accurately, so that requires quite a lot of script reading and advice on various different things. During Awareness Month, we had a collaboration with all of the other Huntington's organisations in Ireland, Northern Ireland and Scotland. I had my Family Matters campaign, and I want to thank all of you within the community who got involved in that and shared their stories and shared their videos and all of the things that you did, because that had a massive impact. Our social media audiences continue to grow, and we've had a soft launch of TikTok. I'd like to talk knowledgeably about that, but I will say I don't know anything about it. But I know that we've reached a new audience with that, and actually a younger audience, and people have really engaged with it. So it's yet another way of providing support to people and different people than we were previously. One of the things as a growing charity is that you constantly have to reevaluate where you are. And during the pandemic, a lot of our office-based staff were obviously, well, all of our office-based staff were working from home. And then once we returned to the office, we adopted a hybrid model of working, like many organisations. That's meant that we've actually been able to downsize the office. I should say that this slide is now slightly out of date, because within the last 2 weeks, we've also moved offices as well, which was something that we weren't anticipating. And well done to our operations team to taking that on and dealing with it. And we now are in the same building, but in a different office. We've made improvements to systems and equipment, buying in expertise and buying in systems like HR systems, which really takes some of the pressure off admin duties and the kind of things that can be very time consuming, but actually there are really good systems and processes in place. So that's been really good. And we've had several new roles. So alongside strengthening our specialist advisory team, we've appointed Vicky, our head of communication and marketing, who you'll hear from a little bit later, a new social media officer, a data manager, an operations assistant, and a senior individual giving coordinator. These are all roles that help us strengthen the infrastructure, which, as we continue to grow as an organisation, is crucial. And as I said before, we've also expanded the specialist advisory service as well. There have been training opportunities for both staff and trustees to make sure that we are kind of working within the law and that we're working within best practice. And our board of trustees have met frequently throughout the year. We continue to support research in lots of different ways. We've kept the Huntington's community up to date with research developments, and that's when there's things that are happening that are positive, but also communicating when things maybe haven't worked as we anticipated or was anticipated, and being able to ensure that people are up to date with knowledge and understanding of that and the reasons behind it, which is really important. We provide funding for HD Buzz, which is an excellent resource where, if you haven't read, kind of gives research into plain English that we can all understand. And we've been working on two big studies, which have both actually been funded by Roche. One is looking at burden of illness, and this will give us some published evidence around the burden of illness of Huntington's disease, which will help us in a variety of different ways, but not least when some sort of disease modifying treatment comes available, actually being able to demonstrate what the impact of Huntington's is on the whole family. The other big piece of project that we've done is a service mapping, so looking at what services are available to families with Huntington's disease across the whole of the UK, and looking where those gaps are, and that gives us some focus then when we move forward into campaigning and lobbying work. We are at the moment trying to gather evidence about cost of living and the impact of cost of living on families affected by Huntington's disease. And this is going to be really important because we're going to be doing some campaigning and lobbying with the government about the impact specifically on families affected by Huntington's disease. So we have a survey out there on SurveyMonkey. If I could plead with you, one thing you could do today after this meeting, if you could go onto our website and complete that survey, it will just give us the evidence that we need when we're looking at campaigning and lobbying work. But thank you. It's been lovely to be able to share some of our exciting plans that we've been doing in the last 12 months.
Thank you so much, Cath. It's amazing how the Huntington's Association has changed even in the last year. It's changing quite quickly and in a really good and creative way. So thanks to you, Cath, and to all of the team for making that happen.